This conference will now be recorded.
Oh, we're having challenges all over the place.
We do video calls all day, every day lately, so we weren't going to put our video on, but if you have your camera on, Dorothy, we'll go ahead and put our camera on. Corey's in Orlando and I'm over in Cocoa Beach today. But what we thought we would do is do something talking to, hopefully specifically to medical practices that are looking to get into telemedicine. And Corey has a presentation that he and I are going to run through that really talks about kind of the lay of the land, what's going on out there, and everything that he's been dealing with as it relates to the practices he's been getting up and going. And he's been getting them up within 24 hours. And so I think this will be good information.
Hey, Jennifer, we are not able to hear you, so I'm sorry. So we did want to talk about being able to help you get on with, telehealth is so important right now. It's really the only way that physicians are able to speak with their patients. And so Corey is the expert over at Insight Marketing Group. And so I wanted to introduce him, and Dennis says he can hear her, so apparently I'm the only one. So Corey, I'm going to turn it over to you. Let me know. I can let you present your screen, so will you take it away?
Awesome. Can you guys hear me, everybody? Yeah?
Yes.
Okay. And Dorothy, you said you're going to give me the option to share the screen?
I'm apparently the only person that can't hear everybody, so. And I'm sorry I can't share your screen.
Dorothy, can you hear me?
I can hear whoever that is.
This is Wendy.
We can hear.
Families. It's Wendy with Embrace Families. I'm not on the screen. It says it's waiting for me. I don't need to be on because I did the phone instead, but just, I don't know if that's error on my part or.
Corey, can you talk them through it? And I'm sorry, we'll provide the presentation after.
Sure. Yeah, give me just 1 second. Let me see. One second.
While we're waiting, while Corey's pulling this up, can we get a sense of who is in the room? Because all we have are initials next to everybody's name. So I see that Andrew's here, Dorothy's here, I'm here, I'm Jennifer Thompson. Corey's the one that's going to run through the presentation, but just wondering if we could get a sense of who else is in the room.
Wendy Hogan with Embrace Families is on the call.
Hi, Wendy.
Hi.
Shayla with True Health. Daniela Sullivan with Orange County Medical Clinic.
Dennis Ferrero with Kaiser University.
Hey, Corey, can you use your thing and share your screen?
I can't. It doesn't give me the option to share a screen.
I can share mine, but that's.
Dorothy, I'm going to suggest that you shoot Corey an email with your login credentials, and then he'll log in under your account, and then he'll be able to share your screen, and then you could just log in as a guest.
and everybody's garbled to me, so I can't hear a word anybody's saying. So Andrew, you're going to need to take a lead on this conversation and take yourself off mute.
All right, so I'm going to try.
I don't know if I got through on video or sound. I'm going remote via phone and texting Dorothy what we've just talked about. So Dorothy's going to try to send your login credentials to you. I'm having an issue with, I don't know if you can get video or not, but trying to send this to you. Because I'm going remote via phone because I was having issues with the login area also.
Okay. I'm going to try and run this presentation. Let me know if you guys can hear this. This is actually a podcast and a webinar that Jennifer and I recorded yesterday where we were talking about what we've been seeing from a telehealth side and how we've been getting practices set up. So I'm going to hit play on this, and if you guys could either say yes or give me a thumbs up in the chat or something, and let me know if you can hear this.
Today we're going to talk about a topic that has been hot and heavy, especially in the last couple of weeks. We're recording this on March 30th, and everybody is just trying to figure out what this new normal is going to be related to social distancing as we fight the COVID-19 pandemic. And Corey, you've been at the front lines helping to get dozens of practices set up on a telehealth and telemedicine solution. So let's get into it and let's talk about telehealth. We are in a redefining moment for the telehealth and telemedicine industry. A couple of weeks ago, President Trump up on the television during a news conference and talked about relaxing the regulations as it relates to telemedicine. And specifically, he got up and said that he was going to temporarily kind of stop violations related to HIPAA. And these kind of two announcements that were part of that same conversation really were a big defining moment for telemedicine and telehealth specifically.
Yeah, and I would say that not only were they defining moments for telemedicine and telehealth specifically, but also for healthcare in general, because patients are now going to expect a telemedicine solution. So when this is all said and done and we go back to normal, patients are going to want and expect to have an option to do a telemedicine appointment. So a perfect example is if your ankle is bothering you, you don't have to spend the time to go necessarily down to the local orthopedic practice. You don't have to make the appointment, take a few hours out of your day and what have you. To get down there, you could just do a telemedicine appointment. And one thing that we've been seeing and all different solutions are touting is that from a practice side, you can see a lot more patients in a lot less time using telemedicine. So the average visit is somewhere between 15 and 20 minutes. And a lot of times on telemedicine, it takes 4 to 5 minutes for the visit. So not only is it convenient for the patient, but it also is beneficial for the practices.
Yeah, and I think that this current crisis is forcing us all to use technology that maybe we weren't comfortable using, patients included. And once a patient has gone through the process of a telemedicine appointment, I think it's like you just said, it's going to be more and more expected. And once people are familiar with using technology and seeing their healthcare provider in this way, it will become the new normal. Now, you mentioned, an ankle fracture or something like that, an orthopedic group, and we have a large ortho practice that we work with that got in front of telemedicine literally the same day that the president made the announcement. They also launched their telemedicine solution. But are you seeing it across all specialties, or are you just seeing it like in one group of specialty or others?
Yeah, we're seeing it across all specialties. So last week alone, we helped a vascular group, infectious disease, ear, nose, and throat, orthopedic, you name it, and they were all signing up for one telemedicine solution or another.
Yeah, and I think we got an email this morning from a really large ophthalmology group, an eye care provider, and they're getting ready to launch telemedicine next week. And so, yeah, I think we're going to see it across all specialties. I don't think that you're going to have the luxury of not having a solution. So let's dive right into it. If I'm looking to get my practice set up on telemedicine, and there are so many options out there to choose from, what are some of the things that I should be considering?
Yeah, there definitely is no shortage of options, and I would say that in the next coming couple of weeks, there's going to be a lot more options because this is definitely a business opportunity for folks in the software industry. And so one of the big questions is, do you want to do something that's app-based or browser-based? And so, for example, we set up a couple of people on app-based platforms like Ortho Live and Spring Health. And an app-based platform is exactly that. You have to download an app for the patient. You'll have to download an app as well, enter a username, password, and then they'll access the telemedicine platform from their phone or from their device. Browser-based, you can use just your regular internet browser, so you can do that from any device that you have. But browser-based won't work on all browsers. So, for example, if you have an older demographic, typically they're going to use a Windows computer, and typically an older Windows computer will use Internet Explorer. And a lot of the solutions, like Doxy.me is a really popular one. Well, that doesn't work on a Internet Explorer-based browser. So if your patient population is a little bit older, for example, we helped set up a gastro group they're out of Southwest Florida, and their patient population is a little bit on the older side. And so for them, explaining to someone that's 70 years and older how to install Google Chrome or Firefox on their computer, I mean, you're not going to get too far doing that. And then there's ongoing costs that are associated with all of these platforms. Some are by provider, most are by provider, in fact. Some offer a free option. Some, however, are going to be paid, or they unlock features as you sort of step up the tiers and pay more money. Other options will collect payments and consent forms. For example, like I mentioned just a few minutes ago, the Ortho Live and Spring Health platforms, those you can actually sign the consent forms within the app. Something like Doxy, they have what's called teleconsent. It says coming soon at the time of this recording. It doesn't exist just yet. So practices are handling these appointments like they would if it was an in-person visit. So they're calling, they're getting this information, they're confirming all of the co-payments and the fees and everything like that before the actual appointment starts. And really, at the end of the day, you have to answer the question of what kind of patient experience do you want to deliver and how are you going to do that?
Yeah, and I think it really does boil down to patient experience. I think in the immediate here and now, emergency, we've got to get our practice up and running so that we can provide patient care. That we have some practices that are just reacting to the immediate situation. Separately, we've got practices who are looking at this as an opportunity to fast track a long-term solution. And so you need to look at it, in my mind, you need to look at it from a standpoint of what kind of patient experience do you want to deliver, but also, are you looking for an immediate solution, or are you looking for a long-term solution that's actually going to be a service offering that you're going to have moving forward?
Yeah, and like you were saying, most people are going to expect this moving forward. So, obviously you want to get something up and running as quick as possible, but at the same time, you have to balance that between, well, now this is up and running, but are we going to have to change everything about it in a month to keep this going?
And I think that leads to this first question I've got for you is, why explain to our listeners and to those that are watching this webinar, why not just use Skype or FaceTime? And we had several clients that started using Skype and FaceTime to deliver a telemedicine solution as soon as the president made the announcement. But we're really encouraging them not to use these services just willy-nilly. And why would we encourage them not to?
Yeah, so for now, like you said, they're fine because there aren't any HIPAA regulations to worry about. But once those come back into play, you're not going to want one of these as a long-term solution. yes, the fee is nominal and the workflow is super simple because you can just make a phone call. In fact, we had an ear, nose, and throat group where we've transitioned and we've set them up on the Doxy Meet platform. And I think there's like 16 physicians in the group, and I would say probably 10 to 12 of them are using the Doxy platform, but some of the other ones are still using Skype and FaceTime because they're sort of intimidated by the Doxy platform. And I would say it's just like anything else, you know, like when you first signed up for Facebook, right? It was sort of intimidating, but then once you get used to it and sort of learn your way around the app, then it's just the new normal. And I think that's a bigger lesson to sort of take away from all this is yes, it can be a little bit intimidating to have this new set of protocols and this new technology, but once you get used to it after a couple of days, it's just sort of the new normal. And one thing that we also heard from physicians is they don't want to use Skype and FaceTime because that shares their phone number, and they're a little afraid that if they share their phone number with every patient that they're seeing, everyone's going to have their phone number and start calling and texting them throughout all times of the day and the night. So these telemedicine platforms obviously keep that information secure. You're not sharing any sort of phone numbers or emails or usernames or anything like that with patients. Usually what happens is the patient will schedule an appointment either on the app or within their browser, and then they're popped into a custom quote unquote waiting room for the physician. And then when it's time, you just sort of click on their little name and start the call.
Yeah, I think those are great points. And I think that, you know, two things here. One is if you're setting your practice up for a true solution and not just something that gets you through today, then you want a solution who is rooted and grounded in telemedicine, and they've been doing this from the get-go. And we would be presumptuous to make any kind of assumption that just because the regulations have been relaxed this week means that they're going to be relaxed long term. And in any given day, we know that the president could change what the violations and the requirements are, and CMS could retroactively go in and fine you on some things that maybe they can look at data from previously. And so it just makes sense to get set up on a solution that's actually a telemedicine solution from the get-go, and not, you know, just because there's a tool out there that could get the job done.
Right, exactly. And if you use like a Skype or FaceTime now, what you're essentially doing is not only are you training your physicians that this is going to be what we're going to do moving forward, but you're training the patients that way too, so that if you do introduce something later that's more of a long-term solution, you have to retrain the patients to say, oh, I can't just pick up the phone anymore and expect a call between 9 and 9:30. Now I have to log in and do all this other stuff. Like, forget that. I'm just going to do something else. So you run the risk of training someone and going down a path one way, and let's say they have 2 to 3 appointments on FaceTime, and all of a sudden in a couple months when they have to come back, there's something totally different, and that could sort of upset the apple cart and change the patient experience.
Yeah, that's a really good point, Corey. So let's go into this. I hear this question all the time, and you're able to answer it for our clients, but how does telemedicine work with workflow and protocols?
Well, just like anything else, you're going to want to draft up a protocol for employees and the docs to follow. So yeah, it can at the start kind of create a little bit of bottlenecking and strain on your side because you have to come up with these protocols, but it also will help you answer a lot of the questions and can be used sort of long term. So we're seeing a lot of practices. I can probably think of at least like half a dozen off the top of my head that are scheduling patients just like normal, and then asking them if they want to have a telemedicine appointment. And that's sort of as far along as they are with their protocols and their workflow. Other practices are actually trying to do everything online. So they updated their forms on their website. So if someone goes to request a form, they'll say that they request an appointment rather. They'd like to request an appointment, then they'll have a drop down to do in-person or telehealth if that's an option. They'll click on the telemedicine, and they're having their appointment schedulers call, confirm the date, the time, secure, insurance information, and everything like that. So they're treating it just as a normal appointment, only instead of coming to the office, they are in fact sending out a link that will go to the private waiting room. Some people, a little bit more on the advanced side, are doing this automatically. So they've created some sort of automation system that says, if you have an appointment Tuesday at 11:30, you're going to get a text at 10:30 that reminds you of your appointment with a link, so that when 11:30 rolls around, you just click on the link on your phone, and then boom, you're in the waiting room and you're ready for your appointment with the doctor. So there's different ways to do it. Some is a little bit more of a manual approach where the office is actually reaching out with a phone call or with an email or with a text to remind patients and telling them where to go. Some folks have gone the automated route and are letting the software sort of take care of that.
Yeah, and I think that it just depends on what the needs of your practice are. And Corey, you've been a great resource to a lot of clients and non-clients asking about how these workflows are working. And you know, it's interesting to see that each one of them, each practice seems to be a little bit different, but they're figuring it out as they go. And I think that, you know, after we get kind of through this initial launch period, that this will just be another service offering that everyone has, just like, you know, walk-in clinics or Saturday hours, it'll now be telemedicine on top of it.
Yeah, so having seen both sides, I totally agree. One thing I will say, so for, again, going back to one of the initial questions is, do you want to go like app-based or do you want to go web-based? And I will say that the folks that are going the app-based side, they do really like that the consent forms are in the app. I think that's a big time saver when it comes to workflow and protocols, because as a patient, you download the app, you log in, and then immediately it asks you to check a couple of boxes, read some consents, and agree. And then that gets filed, and you can you know, either integrate with your EHR, and then that goes right into the chart, or you can log in, you know, through the dashboard of the app, see that they filed these consents, download them, and then throw them in the EHR yourself. Whereas on the browser side, like a DoxyMe or a Teledoc, those kinds of solutions, they depending on the plan, do not offer that. So it's an extra step from a workflow side for your staff to get the consent forms done, which again, depending on your population, can be kind of tricky right now, because you're going to ask people to print these things out, sign them, figure out how to scan them, and then send them to you, and that can create a whole other set of issues right there.
So Corey, another question for you. As it relates to workflow and protocols, if we have, especially in the here and now with social distancing, how are practices communicating this with their staff? How are they getting it across and doing the training for these new workflows, new protocols to get everybody up and going?
Yeah, so what I've seen so far is just like normal, if an office creates like an inter-office memo or posts something on the intranet, they're doing those things as well, because most staff that are at home, they're like remoting into their desktop so they can still see those messages. I've also heard one office is actually, not only do they send an email to everybody, but they're actually sending just like regular piece of snail mail out to their employees with this new protocol, saying, essentially announcing that yes, we now have telemedicine. Here's how it works. Here's things to be aware of. If you have any questions, contact so-and-so. And they put sort of someone on their admin team, like as a point person. So all of the employees will funnel up and ask all of their questions to them. And they're sort of like the unofficial, official team leader of the telehealth.
All right, so let's just keep going. All right, so looking at it from a standpoint of, you know, your docs and your patients, what is it that you need to tell your docs and your patients? What is it exactly that they need to know when you launch a solution?
Well, this is an entirely new way to perform medicine. So I think that the best thing to do is assume that nobody knows anything. So just, you know, start from step one. So for example, one of the clients that we work with, they went the app-based route. And so we created a website, a page on their website that of course says, yes, now we offer telemedicine. But then if you scroll down a little bit further, it actually has the links of where to get the app, and then a step-by-step walkthrough of what to do to sign in. Because we don't want to assume that everyone knows that they're going to be sent a link, or they're going to have to enter their password, or whatever the case may be. And it's the same thing with any sort of browser-based solution. If you can walk everyone through and be as specific as possible on the physician side and the patient side, you're going to avoid a lot of headaches. Another example, I was working with a group last week, and they had dozens of questions. And so probably every 15 minutes or so, I was getting a phone call that said, hey, are you available? I've got Dr. So-and-so on the line. And then so I'd answer the phone, and it would actually be a conference call with like 15 of them and I was trying to like rapid fire answer all of their questions. And I don't know if anyone on their side was taking notes and getting ready to write up that protocol, but that would have been a really good idea on their side, because as physicians come and go, as staff come and go, you're going to have all these same questions as new people get introduced to this. And until it does become the new normal, you're going to need to explain every piece of how these operations work.
Yeah, and I'm gonna give ourselves a shameless plug here. So we have our training company side of the business that actually has an LMS where you can take these protocols and workflows and do a quick screen share on your videos, throw them into the LMS, and provide the same training to everybody. And so I'm going to encourage folks out there, if you need to train your employees or train your doctors, to look at the way that you currently are training people and see if there's a method for you to do it once, load it, and then provide seamless training across the board, because you actually may have the solution already in place in-house, and you just aren't thinking in terms of using it for a training solution for everybody on your team, especially right now if you're having to work remotely. So let's go right into, what do you need to do if you're going to use telemedicine at your practice?
Yeah, so for the most part, all of the solutions are relatively the same in how they actually deliver the telemedicine visit. So typically a patient is sent a link to quote unquote visit the office. The patient is then instructed to click that link several minutes before the appointment. That pops them into a waiting room. And then when they're in the waiting room, it will make sure that either it's an app or a browser has access to a camera and a microphone, because obviously you need that. You're just treating this as a video phone call, essentially. And then we've been telling people to be prepared to be on camera with the physician and the support staff. So one issue that we've been running into a lot is, how do I include an MA or a nurse or whatever in this visit? And so the answer that to that is, if they're in the same location, it's relatively easy. You would start the visit like normal, and then you could actually start with the MA or the nurse. If they could come in to the call with the patient, and then they'll address the chief complaint, get any sort of vital information, ask any questions, do whatever you need to do there. Pause the call, walk outside, tell the physician, hey, your patient in exam room 3 or whatever is ready for telemedicine. Physician goes in, starts the call, has the visit just like normal. If they're not in the same location, so for example, we have a vascular group that we work with, and the physicians, a lot of them, they're considered like high risk because of what they're doing in the hospitals. So they're actually working from home, and they're not seeing patients at all in the office. They're actually staying out of the office. So for example, what they're doing is they have nurses and MAs in the office. The physician is at home, so they have another account set up. They're using DoxyMe, that's their platform of choice. So they have an account set up for the nurses in the office. So they're starting the call and then putting them on hold, and then actually texting the physician at home, hey, this patient is ready, like Debbie Smith is ready. And then the physician can see that Debbie Smith is in the patient queue. So then he'll go in and start the call. So it's, again, working out their protocols and that workflow. It's very fluid, but that's how they're doing it from different locations, and they're making sure that they can be on camera either at the same time or as needed with support staff. And then, of course, you want to have a reliable and stable internet connection. You have any documentation and photos ready to upload as needed, and that goes not only for the practice but for the patients as well. We're telling them to also be prepared with any sort of documents or photos or anything like that. They need image studies, etc.
So from a browser standpoint, what do folks need to use if they're using like a browser based?
Right. So if you're using a browser-based platform, you want to make sure that you are using Chrome, Firefox, or Safari if you're on an Apple device. If you have an iPhone or an iPad, you actually don't have to do anything, which is nice. It kind of goes back to the whole Apple slogan of "it just works." Everybody has Safari installed on their devices. So if you're doing that, if the patient has an iPhone or whatever, totally fine. You don't have to do anything there. Same from an Android device. They'll have Chrome pre-installed. That's the browser of choice. So you really don't have an option to kind of mess those up. It's when you're on the desktop computers that you introduce that element of the Internet Explorer, which can potentially be an issue, which is why some folks are just saying, you know what, I'm going to go the app-based route instead of the browser-based, and just get rid of the desktop entirely and just say you have to have a smart device. So again, that's something for your practice to decide if that's the right way for you.
Are you finding that, in your opinion, because you've been doing both of these, that the app-based is more stable than the browser-based?
No, I think from a stability standpoint, they're probably about the same. And I would also say from an implementation standpoint and ease of use, they're about the same. The app-based does require the extra step of downloading something, but if you're familiar with, if you download Spotify or Google Maps or whatever on your iPhone, most people know how to download an app. So it's really just an extra 10 seconds or so. And when you do that, it does alleviate any sort of possible user error, because the app only does one thing. Whereas, your internet browser, you can have 50 tabs open and you've got pop-ups and music going and all sorts of other things happening, which can create more confusion. And the app is just sort of, you're in the app and that's what it's doing. End of story. So I think from an implementation standpoint, the app does require the extra step, but it might actually be a little bit more preferable to the browser-based. But I've heard both positives from either side.
Are you hearing anything in terms of special protocols that are having to be put into place related to older populations, especially like Medicare and Medicaid populations?
No, not necessarily, because because of what's going on right now, you're able to see Medicare and Medicaid on telemedicine. So nothing really in particular that's out of the ordinary.
I'm thinking specifically like older populations. How do you train them, or how, if an older population, I'll use an example. I was listening to one of my neighbors, yesterday. I could hear them on a balcony in the condo that I'm at, and I could hear them say that how they were like going to pop a bottle of Prosecco because they were going to celebrate. They figured out how to use Skype finally. And, I just wonder, from the standpoint of an older population, are they able to figure out how to update their browser, or can they even figure out how to make the app work on their phone, or is that going to be a problem for them?
Yeah, so one way around that, or the help that we've seen and we've helped implement with a couple of different practices, is a step-by-step walkthrough of what to do. So it's either screenshots or a quick video that actually shows someone click to download this thing, or when they receive the text message with the office location link in it, they open up the text on the video, click the link, enter their name, press start. So it literally is all you have to do, step by step. And if there's someone that, if they can't figure out how to click that link or open or allow those permissions or whatever, then what we've been seeing is having people just call the office and then try and either troubleshoot with them, which obviously isn't the best solution, but it's really one of the only ones that's available at the moment. So either troubleshooting with them at the office, or handling an appointment, honestly.
Yeah, I think that there's a business opportunity out there for somebody who wants to do that troubleshooting and kind of be that customer support.
Yeah, absolutely, because there are people, like you said, that cannot figure this out, and if they can't figure out how to do a video call, then they're not going to be able to figure this out, and that's a population that's just not going to be able to benefit from telemedicine.
Yeah. All right, well, let's get on to the positives here. So telemedicine provides an opportunity to do some marketing and to have something to talk about. So, we've been doing a lot of market. So let me back up. We've been providing a lot of these implementations and serving as a sounding board of knowledge as it relates to the different telemedicine solutions out there. Our wheelhouse is in the marketing that goes with it. And so we were very put together kind of a package to help people roll out their telemedicine. And so let's kind of go through kind of the things that we're seeing that are working for us, that those practices out there that are watching this or listening can actually go ahead and do for themselves as well. So why don't you just run through that list for you?
Sure. So couple main things that you're going to want to do right when you have your telemedicine solution in place and you feel comfortable with it. You're going to want to update your website, preferably the website slider. That's that big image that you usually see on the front of a website. So right when you land, something right there that says we now offer telemedicine. Doesn't have to have any additional details, just says we now offer this, click here for more. When they click, that should go to a blog post or a telemedicine page that outlines what the solution is, how to use it, things to be aware of, some limitations, things like that. You're also going to want to put together a flyer that you can use in office because, again, when things do get back to normal, you want to let your current patients know that they do have this option. And then, of course, some social media. So just, again, mirroring the website slider look in the announcement that says that we now offer telemedicine. We've also got, from some of the practices that we work with, we've been seeing physicians send over photos of them with their telemedicine solution at home. We had one orthopedic provider send actually like a 20-second video of his setup at home, and he's got his screen up with the telemedicine app, and then he's got his computer off to the side, and which he's remoting in so he can access the EHR, and then he's got another computer if he needs it. He was really proud of this setup, so he sent us a video that we posted of that. You also might want to consider a fax blast to referring partners to let them know what you're doing. Same with email. If you have emails for referring folks, then you're going to want to email them as well. And then make sure to email or text your full patient list that you have this option. So typically through the portal, you should be able to send out sort of a blast to everyone that's enrolled. If you don't have that option, then you can just, if you do collect emails from your website, you can send out an email that way. And then you also may want to consider doing some advertising. Now could be a good time to gain a lot of traction there. We think that doing social and some social advertising and then Google ads would do very well. And so one thing that people may not know that you can consider doing is alerting local directories and news outlets, because especially right now, a lot of news outlets are, they have lists of what places are still open and still offering services, so you can add your practice to these lists relatively easily. Same thing with local directories. You can update those to say that you now offer telemedicine. And if you have your listings claimed on any sort of the online reputation platforms like a HealthGrades or Vital, some of those places, they actually allow you to check a box that says that you offer telemedicine or telehealth. So be sure to do that as well. Again, if you have the ability to update your website appointment forms, we suggest that you do that. So what we've been doing for a lot of clients is for website appointment request form, if someone says that they want to request an appointment, we've actually created a new question that says, do you want to do an in-person or a telemedicine appointment? And that gets sent off to the appropriate parties as needed. You can also have schedulers ask patients if they want to do a telemedicine appointment. That's a really simple one that a lot of people seem to have missed at the start of this, is just asking folks if they want this, because they don't know it exists. So if they're on the phone with the patient and they're trying to schedule them, pose that question, because the answer sometimes is going to be yes, of course, and then that will obviously affect the way that the schedule works, but it's also going to open up some space on that physician's schedule.
Yeah, and I'm going to say this too, like the fact that we're in the immediate, we're talking about COVID-19 and getting telemedicine set up and things of that nature. In the long run, your marketing is going to be a little different. But in the short run, there's an opportunity to have fun with this. You know, we have a provider that sent over this morning a picture of him on a telemedicine call, and he's in his white coat and a pair of cargo shorts that he would never wear to the office, but because he's at his home office doing telemedicine appointments, he's having a little bit of fun with it. And I think there's an opportunity to have fun, like you were saying, with the doctor who sent the 20-second video, and really kind of leaning into, you know, that this is kind of the brave new world and this is how we're delivering medicine right now. I just think there's an opportunity. And just to touch on something that you mentioned, which is the fax blast, we know that medical practices still use fax machines. And when you can't go out and visit with referring physicians, faxes are an easy way and relatively inexpensive way to get your message out there. So we had a practice that sent us a list of 900 of their referring partners, and we're doing a series of messages to those referring partners using the fax machine. And so, kind of looking at the traditional way of things that have been happening, and then, what you can do to reach, potential patients and referring partners, maybe outside of what you would typically do. But I'm going to say, like, have fun with this marketing because you finally have something new to tell people.
Yeah, absolutely. And like most marketing, it's obviously about letting people know what you're doing. But I think with telemedicine, especially in the long term, there's such an opportunity to talk to your internal audience, your existing patients, and tell them what you're doing as well. Because again, the more people that you can move to telemedicine, the more time that can free up on a clinic schedule, which allows you to either see more patients or just sort of shift those things long term, and that can really have a big impact on the business. So now is the opportunity to say, of course, yes, we now offer this. That's all we have to worry about for right now. But 3 months from now, you need to update some of these things to consider what's long term the best answer for the business to see the most amount of patients and still provide quality care.
Absolutely. And in the short term, I'm going to say that now is a great time to spend money on AdWords and on Facebook ads, because a lot of the big players, at least short term, have pulled out. So a lot of those eyeballs that you were competing against, especially like in Facebook auctions and things of that nature, those players aren't there. So finally those eyeballs are available, and we might see those rates starting to come down. And I'm hearing this across a couple of different channels just this morning, that a lot of those restaurants and retailers that you were competing with, they're no longer in the space because they've hit pause on all those budgets. So there might be an opportunity to gain market share in a downturn. And if this is hopefully a short-term opportunity, then you might want to lean into these telemedicine services and really get the word out there.
Yeah, absolutely. So not only is there less competition, but there's more people looking because there's more people at home and they're just sort of scrolling the newsfeed. So they're waiting to see your ads.
That's exactly it. It's been a long time. So we talked about how you can spend money. Let's talk about how you are actually going to get paid using telemedicine.
Yeah, so a lot of platforms have a payment feature allowing you to collect before the visit. So, for example, on some of the app-based platforms, you'll enter your information, you log in, and then one of the first things is an option to enter a credit card. So we've seen practices doing this in a couple of different ways. Some are just saying, for example, there's a $50 self-pay for any telemedicine visit, or if that winds up in a in-person visit, we'll apply that $50 towards that visit. We've also seen it to where one practice is doing it where it's $50 self-pay, and that's it. So if that winds up in person, well then too bad, that there's $50 for the telemedicine visit. Some people are saying that the cost of the telemedicine appointment is the same as an in-person visit, so copay and deductibles will still apply just like normal. Copays and deductibles will be collected prior to the visit, and then you may receive a bill for any balance after the appointment. So it's sort of run the gamut. It depends on your practice and your specialty specifically in terms of how you get paid, but we have seen it in a multitude of different ways.
Yeah, because practices, at the end of the day, I think it's great to provide a service, but we're going to want to know how to get paid. So what do I do if I have multiple providers?
Yeah, so if you have multiple providers, this is actually one that we've heard a few times. So I touched on this a little bit earlier as well, but like here's the scenario. So the practice wants an MA to enter the call first, get the required info, the chief complaint, leave the call, and then have the doctor come in afterwards. So most solutions have the option where more than one provider can enter and leave a call from wherever they are, and you just have to pay for that feature. So depending on what you go with, for example, if you're doing like a doxy, everyone can share a room, and then you can leave and enter that room or that call as needed. If you're doing something that's app-based, they'll have like a dashboard where multiple people can either enter the room at a time, or you can see from a dashboard access and who's going to go in and who's going to go out. So I think, in short, yes, of course, if you have multiple providers, each one of these platforms is going to provide a solution. Typically, again, you pay by provider. So the more providers or accounts that you set up, the more money that's going to be. One question that I've heard from a lot of practices, and I'll use Doxy as the example here. So as of this recording, it's $50 per provider. And so let's say you've got 5 providers and you want to have each provider with their own MA. So does that mean that I actually have to have 10 accounts at $50 per account? And the answer is yes. If they're in different locations especially, then you will need 1 account per person that's going to use the platform.
All right, and then I know we already touched on this a little bit, but if I want to get files uploaded to the platform, how do I go about doing that, or what should I be considering when I'm choosing my platform regarding files?
Yeah, so most platforms give patients and providers the ability to upload or download images and files as needed. And if you pay for an integration with an EHR system, then when those files are uploaded to you, they will automatically, in most cases, get sent over to the EHR and stored that way in that patient's chart. But I know a lot of people, especially in the short term, they are not doing those integrations. 1, because they're cost prohibitive, and 2, because they just take so long, honestly, to get set up. The last estimate that I heard was it can be anywhere from like 60 to 90 days before that integration is ready. So what people are doing is sort of a workaround is if you do need to see some sort of an image study or photos or something like that, they are just sort of accepting them in the app and then downloading them to their local device and then uploading them into the EHR after the appointment.
That's a lot of information, Corey. So real quick, let's just kind of recap where we are. Telemedicine is the new norm. And I think that the pandemic and forcing us all to be thinking about it is forcing the conversation. But really, once we've all had the conversation, it's going to be expected moving forward. Next, we, as a provider, I need to make the decision, long-term, short-term solution. Do I want to use an app-based service or a browser-based service? And some of the things that we need to be thinking about is how we're going to accept payment, how we're going to get paid, and how are the consent forms going to work in the solution that you choose. How are you going to implement, the proper workflow and protocols, and how are you going to communicate those workflow and protocols to your employees? In the short term, how do we do that when some of our workforce is having to be furloughed or laid off, or working from home, and we're having to implement social distancing guidelines? And how does this look when you're trying to do something a lot quicker than you typically would from a workflow and protocol standpoint? And then how are you going to market the services? Where is this an opportunity to do some marketing that maybe you haven't done in the past? And can you have fun with it a little bit and provide a little bit of levity when you're announcing those services? And are there the opportunities, because that people are pulling out of the advertising marketplaces and pulling their ad dollars away from spending because places are closed and things like that? Are there new opportunities for you to reach new audiences and to get a little bit of leverage on your competitors? And then you got to start thinking, how are you going to get paid? Is CMS going to, or is CMS, are they going to reimburse? Are you going to get paid for those for those new patients versus your established patients? And so these are kind of fluid conversations that need to take place as we are setting up these telemedicine services. And then what do? It's different if you're setting up 1 or 2 providers, but what if you have 30 providers and you have 10 locations? That's a totally different conversation that's taking place. And what are you supposed to do with that? So, Corey, you've provided a lot of important information and things that people need to think about when they go to set up their telemedicine solution. But if you were going to provide one last piece of advice to those folks out there that are either listening to this or watching this in the Dr. Marketing Tips Lab, what would you tell folks as they are embarking on kind of this brave new world of telemedicine?
Well, I think exactly that this is a brave new world of telemedicine, and this is the new normal. This is the expectation. So you're going to have to offer this. And no, it's not going to be perfect, especially at the beginning. but it's going to work. And you have to get those protocols in place up front and train people the right way. Because if you do that, one, you're going to save yourself a ton of headache on the back end. Trust me, because I'm dealing with that now. We set up a lot of these things last week, and now people are starting to realize all of the holes that they have to plug and what they have to do. So that as they're creating these protocols, they're evolving these workflows. That is, I would say that the biggest piece is there's such an opportunity here, but you have to make sure that everyone is trained and trained for how you want them to work long term. Because once this solution is in place and whatever one you decide to go with, that's probably, if we're being honest, the one that you're going to stick with. So make sure it's the right one and make sure you have all your ducks in a row before you get started, because it's going to save you a lot of time and headache and money on the long end.
Yeah, and I think that's just about it. So thank you everybody for joining us here today. I know this is a long conversation, but I think it's going to be an ongoing one. And you know, you can look at it as glass is half full or the glass is half empty. And so let's look at it as we have an opportunity in front of us and we need to pivot and make it work for our businesses. So with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips podcast. Thank you.
Okay, I don't know, Dorothy, you still have no sound, right? So if there are any questions, I want to direct them to, you can say them out loud, or if you want to send them to a chat in the chat side for Jennifer or for Corey. Anybody have any questions?
Well, while we wait on some questions, first of all, thanks everybody for joining us. And we actually have, so this was a webinar that Jennifer and I recorded yesterday. So if anyone is interested in seeing some of the slides that go along with this, it kind of helps guide the conversation, then we can get that to you guys as well.
And if you'd like to send them to Dorothy or myself so we can
Absolutely.
have those available too, we'll be glad to post those. I utterly apologize for the technical difficulties. We're new at this too, and new systems, and we've done a number of tests, but still with that, we have had our challenges. Like I said, I can't figure out how to get video. I'm blocked out from having video on here, but I can hear and see. So, you know, as we move forward, I know this is all a challenging time for us in many ways, but we do appreciate the information that you've provided, and I think there's some great information there. And if we need to redo it at some time in the near future when we get this up and running, we'd love to do that again, or if there's other information. But I don't know if any chats or any questions are coming through.
Nothing on my end, but yeah, we would be happy to help at anytime you need it.
Yeah, and Andrew, I
Great
think,
info.
thank you. We're launching this week. We've got a bunch of resources that are coming to us, like a bunch of questions that come to us from the practices we work with. So we're going to probably today or tomorrow launch this thing that for free that we're calling the lab. So that just so everyone knows, the Dr. Marketing Tips podcast is the podcast that we've been doing for years. And we load a new piece of audio. So I threw in the chat a link to that if you want to see or hear any of the things that we've done over the years. We have over 200 episodes that we've put together, and we get about 50,000 listens to this thing, and it does really well. And it's from the perspective of being inside of a practice and what we see on a day-to-day basis. But we'll shoot over, Dorothy, we'll send you the link to the info if anybody wants the stuff for the new lab that we're launching. And in it, we've got these slides, and then we have, like, if you have to close an office temporarily, because we have a bunch of clients that are closing offices temporarily, we have your complete, like, step-by-step what you need to do at your medical practice to shut down that office so that your digital footprint shuts down with it for those communication. And then we've got like the communication plans and crisis plans specifically for medical practices in there. So as soon as we get that stuff loaded, I'd say later on today, I'll shoot you over that link. And then if you want to send it to people in this webinar, it'll probably be really helpful information. It'll have these slides plus a bunch of other stuff too. All right, guys. So I'm going to run, but thank you very much. It's always a pleasure. Let us know if there's anything that we can do in the future.
Thank you.
All right, so Dorothy, I'll send over those links, and yeah, if there's any other questions, feel free to send them our way. And Andrew, thank you as well.
I know Dorothy has no sound. If there's no other questions, we'll go from there. I'm kind of caught between another working on OCPS stuff here now. So thank you for everybody that is there, and we'll reconvene another time.
Take care, guys.
Thank you.
Thanks.